No. Okay. Whenever you're ready, Dr. Shah. Or
Okay.
Navina.
Yeah, I'm
Hey,
ready.
okay. Hey everyone, welcome back to another virtual shadowing session. We have Dr. Shah with us today. Thank you so much, Dr. Shah, for coming. She's going to be sharing her experiences, any tips you may have for us. And whenever you're ready, you can just start.
Awesome. All right. So, hey everyone. Thanks for tuning in. I hope you guys are all safe. And my name is Dr. Helly Shah. You can call me Helly, Dr. Shah, whatever you want. I'm going to be sharing my path to dentistry. Everyone has a different journey on how they get there, but the end goal is generally the same, especially if you want to be a dentist. That is my email address, and that's my Instagram handle. I'm pretty active on both. I just got an email from Google saying that I'm almost out of storage, so it might be easier to DM me on Instagram if you have any questions. All right. A little bit about me. I pursued my Bachelor of Science in Biomedical Engineering from Drexel University. I graduated in 2012. I actually did not decide to pursue dentistry until the end of undergrad. So I had a pretty non-conventional path. I started clinical shadowing. I think it was around the around my junior year, I'd say, of college. That's when I first started considering dentistry. I still wasn't sure. And then I went to UMDNJ and I actually did some oral biology research for about 6 months before I finished up undergrad and whatnot. So by the end of undergrad, I did decide that I wanted to pursue dentistry. The problem is that I didn't take any of the prerequisites. I mean, I had some of them, but it's a different curriculum. So then I did a master's program of biomedical science from Rowan University. It used to be UMDNJ as well. It's kind of changed names. And that's where I took all my prerequisite courses, really focused on my GPA, studied for the DAT, and I did perio research at the University of Pennsylvania for about a year. And I learned a lot. I learned kind of how to manage my time better, what study tactics work best for me. I really focused on being more disciplined in the academics because I knew that if I couldn't do that, I probably wouldn't be successful in dental school because dental school is so much harder. I interviewed at multiple schools and I accepted at LECOM, School of Dental Medicine. It's a newer school. It's in Florida, about an hour south of Tampa. I think they actually are one of the schools that accept virtual shadowing. I might be wrong, but I don't know. So yeah, I was in Florida, and it was a big change for me because I'm from the Northeast. I'm born and raised Jersey girl, all of that. But it was a really good experience. I was very happy with my decision to go there. Towards the end of my dental school, I guess, curriculum and whatnot, I just started to have cold feet about working in the real world. They really don't teach you much. I mean, you learn the bare bones, and to think that I had to work on my own license on people and be liable for all these things, I was like, I'm not ready. So I did a general practice residency program at New York Presbyterian Brooklyn Methodist Hospital. And I learned so much there that when it came time to look for jobs again, I started getting cold feet again. So then I stayed on for a chief resident year. So I basically did whatever I could possibly do to prolong going out into the real world, just because I feel like I just wanted to do the best possible treatment that I could do for all my patients. And I wanted to get whatever maximum training that I could before I did that. Highly recommended GPR. If you do pursue dentistry, it's just crazy what you don't know when you're in dental school. And even in residency, I learned so much. I learned so much every single day practicing. So that's in terms of education, that's one thing I would recommend, is definitely do a general practice residency, even if it's for 1 year, because you'll probably learn more in a year than you learned in 4 years of dental school, to be quite honest. Okay. So what's my typical schedule? Okay. So because of COVID, it's kind of been changing. It's been fluctuating a lot right now. I work Monday through Thursday, about 10-hour days. I was off today randomly, so that's why I decided to do the presentation today. And I work 1 to 2 Saturdays a month, mostly one, unless I really, really want to come in for a second one, but it's really just one Saturday. I do a little bit of everything. I do a lot of fillings, crowns, root canals, extractions. I got Invisalign certified when I was at the end of my residency, so I've been doing some of that too. The one thing I will definitely tell you all is the most important thing is diagnosis and treatment planning. Like, if you can't diagnose a problem, then you can be like amazing at the treatment that you do, but if it's not really solving the issue to begin with, you're not really helping anyone. You will get a decent exposure to that in dental school, but the one thing that I'll say is that real life is a little bit different. Not all patients can do the most ideal treatment for any type of condition. So it's just really important. You need to know how to present treatment plans and explain like multiple options to them if there are. So you make a decision. You involve the patient in the decision-making process. It's very important. That's what allows you to keep patients for long periods of time. I generally see about 8 to 12 patients per day. Again, because of COVID, it's just so random. That's like an average number. All right, so pros and cons of dentistry, or general dentistry, I guess. Pros: confidence building. You're building confidence in your patients and yourself. You get to restore smiles. You help patients chew, eat better. You get them out of pain. Money, I always say it's a question mark. I don't know who created this rumor that dentists are rich and they make a lot of money, because I think things are changing a lot, and a lot of like my bosses who've been practicing like 20, 25 years, they'll always tell me that like, you guys will make a good living, but it's not going to be the way that it was like in our time. And there's multiple factors as to why, but it should not be the main reason that you're deciding to become a dentist. Trust me on that one. Cons: you're dealing with dental phobia. 90% of your patients do not want to be there. They're afraid. You guys are probably afraid to go to the dentist yourselves. Like every time someone has an appointment, they're like, oh my God, please don't find anything. I don't want to do anything, like all of that. So you're dealing with that. There's a lot of schmoozing. You have to calm them down. You have to develop that personality. If you're working under an existing practice, there could be autonomy issues. You may have things in your schedule that you may agree with, you may disagree with, but sometimes you may have to do it just because it's in your schedule. A lot of the times, if you really strongly disagree, they can't like make you do something, but it's a little bit limited because you're a doctor, but you're also an employee if you're working for someone else. So there is like that slight power struggle, if that makes sense. And there's associateship struggles, like getting used to specific materials, getting used to the way things run. Like, I work at 2 different offices, so they both use a different root canal system. They both use a different filling system. They both use a different scanner. Like, everything is so different. So I have to like learn like double the stuff, and it's a lot. And I use different things in dental school. In residency, I use different things, and now I'm using it's like I've gone through like 4 different stuff, and it is a lot to learn, and there's a learning curve to some things, and you have to be open and flexible. So this, I'm just gonna put out there. I saw this literally like a few days ago, and from my life, like from what I can remember, in the last 10 years at least, like I remember that dentist was like always like fighting for like the first like top 3 positions with like the best jobs and whatnot. Even in 2020, dentist was number 2 and best healthcare, they were number 1. This year, we don't even make top 5. We're like number 9 in 100 best jobs, and best healthcare jobs were like number 5. And this is like honestly in my lifetime, this is the lowest that I've seen. So it's definitely something to consider. I think it's a lot related to COVID. You can see a physician assistant, nurse, and physicians. Those are like the top 3 right now because it just makes sense with the world that we're living in. And we don't know the long-term effects of COVID on the profession. We don't know the long-term effects of it on the economy, like anything like that. So, it is something to consider. I love my job. I wouldn't have done it any other way, but I'm just putting that out there. Okay, so why did I decide to do general dentistry? I'm going to be very honest. I feel like I graduated in 2018. I graduated just in the nick of time. I think if I graduated in 2019, I would have definitely done at least 1 year residency. I think I would have decided to specialize. If I was to graduate in 2020, I would have also specialized, just because general dentistry right now, it's very difficult to do like a little bit of everything right now, just because 4 out of 10 people have lost their dental insurance. A lot of people come just for emergencies. It's been a little bit more challenging than usual to do like comprehensive care where you are doing a little bit of everything. So because of that, I think I would have specialized so that I just get really good at like one thing and then just do that for the rest of my life, because I do like to do a little bit of everything. But right now, the way that things are, you may end up just doing like a couple things more often than like other things. So, I mean, I could obviously discuss that more at the end if you guys have specific questions about that. But the reason that I pursued general dentistry to begin with is because, you can do as much or as little as you want. Again, exposure to a little bit of everything in an ideal world. You can refer out difficult cases, things that you're not comfortable with. Like I will refer things out sometimes if I just feel like I don't think I'd be able to do the best possible job for someone, then I will. Or if the patient's expectations are super high, like they're like 60 years old and they want to look like they're 20, and you can't do that. Like you'll refer it, and you'll find people who will want to take care of those kinds of patients. I'm not one of them. Okay. So the future of dentistry. This is just like a couple of pictures. The top right picture, that's digital x-rays. So back in the day, we used to have like film x-rays, and I think a lot of offices probably still use that. They take a picture, they develop it, and then you kind of see it on like a little box, like a little light box, and that's kind of what you use. The radiation dose for that is a little bit higher. Digital x-rays, you literally just take an x-ray and it comes up on your screen right away. And you can like blow it up for patient education purposes, like kind of like how this picture, they like circle the cavity and whatnot. The radiation is also less, and it's quicker because you take your x-ray and it's right there. So dentistry has definitely come a long way. In terms of patient education, the bottom photo is an intraoral camera. It's basically like a little wand you take, and you can take pictures of teeth. And again, you show the patient, this is what this looks like, and this is why you need this. And it's just, if you can see it, you'll believe it. If you don't see it, then maybe you might not believe it, or you might not be convinced that you really need the treatment that's recommended. The bottom left photo, it's just an example of a scanner. The first photo on the left, that's a CEREC scanner. It basically allows you to, instead of taking like impressions of crowns or for like Invisalign or night guards, anything you might need impressions for, it allows you to scan. It's way more accurate. And it's cool. Again, you can show the patients like what their teeth look like and stuff. And it's super neat. You can design crowns. if you're lucky enough to have a milling unit in the office, you can actually make a crown the same day. And the patient comes in and you prep the crown, and hour and a half, 2 hours, they go home with the crown in their hand. So I think dentistry has come a super long way. I didn't even know this was possible. My dental school, when I attended, did not really talk much about digital dentistry. So if you apply to dental schools and you interview, it's definitely a good question to ask, like, what kind of digital technology are you implementing? What are you training? Because I do think digital dentistry is the future. And I mean, if you're not going to be exposed to it, it's a little bit challenging to like go out into the real world and kind of learn how to do it. I mean, we all are right now, but if you can have even like a little bit of experience, I think it'll help you a lot. So people always ask like about corporate dentistry and like, is it good? Is it bad? Should I do it? You know, all that. I didn't even know what corporate dentistry was before I applied, but you know, it's a lot more popular now. So I'm going to just talk about some things that I know about it. I never really worked in one. I'm just kind of telling you based off of what like any of my friends were there, what they're doing and all of that. So basically it's just like large corporations. It could, honestly, I don't know why I wrote large. It could be a small corporation too, but they just take over practices and they control all the administrative aspects. So they control the scheduling, the marketing, the insurance, like everything, like all of that, like bookkeeping. And you as a dentist, you just do the dentistry. Like you're not responsible for doing anything like that. But it's usually not run by dentists. So it is like like people who aren't really in the medical field, who own these practices, and then like, you know, you're a dentist and you work. And a lot of the times they're like group practices where you might have like all the specialists under one roof and like two general dentists, and you like all kind of work together. You do internal referrals and all of that. So like all the income like stays in house, which is pretty smart. It has largely taken over most states. I went to school in Florida, and we have a lot. Like I think most of Florida has been taken over by corporate dentistry. I would say my friends who are still in Florida are all working for corporate dentistry. So it's definitely become very popular. Like, why would someone want to do corporate dentistry? So student debt is a huge thing. You're in about like $250,000 of debt after you're done with dental school. That's just average. There's schools that are way more expensive. I definitely went to one of the cheaper schools. My school was private, but I think it was the cheapest private dental school out there. A lot of people want better work-life balance. So they don't want to deal with administrative things. They want to come in, be a dentist, do their job, and just leave. There's nothing wrong with that at all, honestly. They generally do compensate better. You'll get like a sign-on bonus. Usually you get benefits, health insurance, all of that. They'll pay for your continuing education. Sometimes they'll even give you mentorship if you ask for it, which is pretty cool. I think I pay for my own health insurance. If I want to take education classes, I pay for it. Like I have a lot of expenses. So it's, you know, it's nice that they're willing to help you out in that regard. And I think one other thing is that insurance reimbursements are kind of declining. So for you to have your own practice and for it to really stay afloat, like it is difficult, not just from a financial standpoint, but if you're not even like, if your insurance plans are not allowing you to stay like cash flow positive, where you're actually benefiting financially from having your own practice, it may not be worth it for you. I'm not saying it's not possible, but I do think that there are fewer people who are deciding to take upon their own practice just because, you know, I would definitely say number one is your student loans, and number two is just like the stresses of having your own business. Okay, so some advice that I have for you guys, and some of these things are things that I wish I knew before I applied, because I didn't really do much of it, but um, I shadowed. I didn't shadow someone who could mentor me. I think you should definitely, right now there is a huge shortage of dental assistants, and I'm sure that, if you look on like Craigslist or something and you find an office that's looking for a dental assistant and they like don't have any crazy requirements and they're like, you have the time and they're willing to train you and you can commit for like a year or whatever, or even maybe like a summer, I'm sure they'll teach you like so much, because that's how you learn. Like if you watch someone do it, it's just so much more different. When I don't have a patient, I'm always shadowing my boss. Like I'm always watching like what he's doing. Sometimes I'll pick up a thing or two and it'll make my life so much easier. And like I'll just be like, oh, I didn't even know that. Like, so it's pretty good. So right now, I think a lot of places. I mean, I know up in Jersey, people are pretty desperate for assistance, so it might be a win-win situation. Um, Once you do decide to pursue dentistry, don't give up. You want to apply with the full package. Don't have that mentality that like, I just want to get in somewhere, like wherever I get in, like is fine, because you're committed to that place for 4 years, and it's so much better for you if you have options and you can pick what's best for you rather than you just settling for like wherever you get in, because it's a huge time commitment. It's 4 years, so just keep that in the back of your head. Do it for the right reasons. Again, dentist not equal to rich, no matter what anyone tells you. Comfortable, yes. Rich, no. Understand that it is a lifelong commitment. So you literally you should never stop learning. Technology has changed so much. Research is changing so much. Like I graduated not even 3 years ago, and I'm doing things differently than I did in dental school. Like that's how quickly things change. It's crazy. And also to keep your license, you have to do a certain amount of credits of continuing education every year. So, you really have to stay on top of that. And it is a lifelong commitment from an academic standpoint. Apply early. I did not. I don't even know when the applications open, but it's really embarrassing, guys. I applied in November. So like you can only imagine. I don't know. I'm pretty sure it opens like in the summer sometime. So definitely be prepared. I probably would have had way more interviews if I did that. And have mentors a few years ahead of you so they can guide you. So it's great to have friends like oh my God, like we all want to go to dental school. It's really cute, but like you're technically competing against each other. So definitely have like people who've done it already, and it'll just help you much more, I think. And I didn't have anyone like that, but I wish I did. All right. So I'm just going to go over some cases. Most of them are, actually, no, all of the cases are from residency, because I was like, oh my God, I'm so cool. I took so many pictures. I don't do any of that anymore. So I don't have any pictures or anything like that of what I do right now, but it's fine. I did cooler things in residency anyway. Okay, so this is my patient. I did a lot of work on her, and she was just fantastic. She's 60 years old. She lost this tooth and this tooth in an accident, and she had like a small bridge back in the day. And anyway, so she lost these two teeth. She could only afford to fix her top teeth, and so what we did was we did like a bridge, like a 6-unit bridge, and this model over here. It's basically just the teeth that I shaved down for the bridge. So it's this tooth over here. These are the 2 teeth she was missing. And then these are the other 3 teeth. So this is kind of what her teeth look like in the beginning. She had like a really weird bite. And she was missing the teeth down here too. So this is what she started out with. This is what I was able to do for her. Again, like I was saying, like pros, like, you're building confidence in patients, you're helping their smiles. Like she loves it. She still texts me like to this day that she's like, you've like literally changed my life. And it's crazy because this doesn't even look that bad, but whatever. She's really sweet. this case would have probably come out a little bit better if she invested in some like orthodontics or like Invisalign for the bottom and like pushed her teeth in. But she was just like, I'm 60 years old. And I was like, yeah, you're right. So we didn't do anything like that. So that's what I mean by like, ideal is not necessarily like the best option for people. Same patient, like I was saying, she was missing all of her teeth to the right of this canine. So we placed dental implants. These are implants. These are healing abutments. And what this is this actually trains the gums to grow in a certain way so that when you put the teeth, like the crown, the bridge on top, the gums will kind of like heal over it. So it gives a natural emergence. So you can't see like metal or anything weird like underneath. So after the implants and after she healed, I took an impression of this. And then this is what the lab sent back. This is called a verification jig. All it does is it confirms that whatever impression I took matches with what's actually in the mouth. So it just reconfirms things because this is like, it's a bigger case. So this was a verification jig and we confirmed that it fit. This was the final prosthesis. I mean, she loved it. I did deliver it to her. And I thought to myself that I will take a picture when she comes back next time. And then COVID happened and I never saw her again, which is kind of sad. But she has the bridge. I just didn't take a picture of it. But this is kind of what it looked like. This is the same thing. And again, like this poor lady could not chew on the right side for like over a year. And now you're helping someone, be able to do that. So it's really great. This patient is another guy that I saw. He had an interesting case. He had trauma to his front two teeth. And he had like what you call a diastema. So this space here, I mean, I'm sure you see it where like some people might just have a space between their like two front center teeth. And he lost this tooth. And I told him the best thing is to just do an implant like right here and you're done. And he was like, no, I want a bridge. I was like, okay. So he wanted a bridge to replace this one tooth. But the problem is like it's such a big space and these teeth are so small. They're called peg laterals. So I told him like, I don't want to cut your teeth without you understanding like what it's going to look like. And he was like, okay. So I told him that we would have to do the bridge from this tooth to not just this tooth, but this to here because the aesthetics will look way better. So he was like, okay. So what I did is I took a mold of his top teeth, like an impression, and then I poured it up in stone. So I had a physical model of like what his teeth look like. Then I took wax and I melted it and I kind of like built the teeth. So I made this tooth a little bit bigger. I put a tooth here. I made this tooth bigger and I made this tooth bigger. And it's called wax ups. And if you go to dental school, you're going to do a lot of it and you're going to hate it. And I still hate it, but it's a really good skill to have because dentistry is like arts and crafts and you kind of need to know how to do stuff like that. I mean, you could send it to a lab, but if you can do it yourself, why not? Because if you send things to a lab, you have to pay for it. So, or the patient will have to pay for it. So, so basically after I did my wax up, I took a little, I used putty and I took a little mold of like what I did. And then I basically put like a temporary material in there and I stuck it onto his teeth. So this is what this is. Okay. It's not perfect, obviously, but this is to show the patient like what it's probably going to look like. So you can see here, this tooth gets bigger. And then this tooth also got a little bit bigger. And then this is the tooth here that he's missing. And then this, I tried to mimic the anatomy on this and this. And I didn't even cut his teeth at all. I literally just put it on top of his teeth. And this is called like a diagnostic mock-up. The reason you do a mock-up is because you want the patient to understand, like you want to fulfill their expectations. Like you don't want to start cutting away teeth and then they hate it. So before you even start, you show them this. And he was like thrilled. He was like, I love it. I was like, okay, whatever. So that's what we ended up doing. I unfortunately did not get to finish this case because of COVID, but it's fine. No worries. This was honestly like this part is actually like harder than like just like cutting the teeth away and like delivering the final prosthesis. So it was still a good learning experience. Okay, so this is one of my favorite quotes. You know, again, you could do as much or as little as you want. I like surgery. I think it's cool. So this top left, this is the first time, this is the first extraction and bone graft that I did. I did it in residency. These are like sutures. It was a really cool case. And then she eventually got an implant there. This was also another bone graft case. This was a tooth that I extracted, and you could see the wisdom tooth popping out from inside. So I thought that was kind of funny. So I took a picture of that. You can, like, residency is cool. You could take pictures of anything. People like don't really care. I think in private practice it's a little bit different though. And then this is a root canal. I like doing root canals too. I like doing a little bit of everything, like I said. So there's just a bit of my collections there. This is another cool case. So this, I didn't do much. I just extracted these teeth. She wanted implants, but her sinus was so low that she needed a sinus lift. So it's basically like you lift the sinus, you literally go in there, push the sinus up, you put bone in there to take the space, you let it heal for 6 months, and then you have space to place implants. So this patient, she wanted implants over here. I extracted them, and then this is the sinus lift, and I can actually show you a video of her breathing in and breathing out, and she's like, you can see the sinus like go in, go up, and go down. It's like, so I assisted a surgeon for this. I didn't have to, but I thought it was really cool. Do I see myself doing something like that? No, but it was still very cool. Little too much for me. All right, I think we're done. Yeah, that's it. So yeah, willing to answer any questions that you guys might have. And thank you for listening. Hopefully this was helpful.
Thank you so much, Dr. Shah. That was absolutely amazing. So now we can like move on to questions. So we have questions from the YouTube channel, Instagram questions, and just stuff like that. Yeah. Okay. So starting off, what's your personal opinion on corporate dentistry? Do you ever see yourself joining in the future, or is private just overall better in your opinion?
So I live in New Jersey. Corporate is starting to kind of come into the picture, but it's not. It hasn't taken over like it's taken over other states. So personally, I don't see myself doing corporate dentistry. I want to have my own practice someday. I think when you work in a private practice, it's much more easier for you to like sit down with like the office manager and like learn insurance things and all of that. With that being said, I definitely don't think that I don't feel like there's days where sometimes you don't get paid as much as like you would have if you did corporate or something like that. But it's much more close knit to work in a private practice. You know, if you have the ability to work with your boss side by side, you'll have that kind of, you know, relationship. And I think overall, I feel like I learn so much every single day from that. Corporate, a lot of my friends work alone, so they may not have someone to ask questions if they like need help with something. So it really depends. For me, like, it sounds weird. I mean, you deserve to be paid for like what you do and all of that. So I'm not like anti making like money or anything like that. But for me, you know, you could see my background. Like I did so much school. So like for me, like learning is so important. I think you take like a year or two in private practice and you like push yourself to learn, even if you're not making that much money. I think it will pay off long term, especially if you want to have your own practice. I think corporate may keep you kind of like at the same place. Like, for example, like maybe you'll be making like 120K, like, or something like that when you start out. Maybe like that will be, maybe you'll get to like in 5 years, you'll start earning like 200 or something like that. Right. But like the potential to grow in corporate is a little bit diminished because you have so many other people who are working there. So like they can't afford to pay you that much. Like, I don't know if like it's just it's very large. It's a large like there's a lot of hierarchy in corporate. So that's like kind of what I've heard. But just to be very honest, no, I don't see myself doing corporate dentistry for the sole reason that I want to have my own practice someday. But if I did not want to, then yeah, maybe I would, just because, then it's like you treat it like a job and it's fine.
Awesome. Okay, on to the next question. Through your educational journey, which you showed us, and just through the process from probably like college onwards, what were some of your biggest regrets, if you had any, or experiences you would change if you could go back, just so that we could learn from them potentially?
Um, so I would definitely say that I was very hardworking in college, but I didn't know how to study, if that makes sense. I wasn't studying effectively. I think I didn't understand like what methods of studying worked for me, which is, you go to the library and you're like trying to study with your friends, but everybody actually retains information quite differently. And I think in college I didn't know how to study, and I wish I invested more time into figuring that out. I didn't actually figure that out really until my master's. So that's definitely one thing. Another thing is keeping a more like close relationship to whoever I shadowed. Really getting into dentistry. Like dentistry is so hands-on, right? So like I would say that in dental school, I could like study for an exam and I got A's on like everything, but the actual like hands-on stuff, that's where I really had to work super hard. And I think it's because I didn't invest much time before dental school into really learning, like materials, or like what does a crown prep look like? What is a filling supposed to like look like? How should you do a filling? Like you learn in dental school, but I think if you have like a little bit of an idea before you go in, you'll definitely be a little bit more prepared. And that's why, I did recommend, if you have time, to try to be a dental assistant. I know shadowing is like kind of off limits, but dental assisting, it's a win-win for both of you guys. So those are probably the few.
Okay, thank you. So moving on to our next question. This is just from the Instagram, and they ask, "How is the work-life balance in dentistry, in your opinion?"
I think it's good. See, you have to kind of think about how much starting out, you really have to think about your like student loans, right? So every month when you graduate, you have to put a payment in, right? Like you have to pay a certain amount. Then you have to calculate how much money you need per month to live. And then you have to calculate how much money per month you want to save. So you have to do that math every month to figure out how hard you want to work. If you don't have student loans, then you could work like 20 hours a week and you're fine. So unfortunately, I think it does depend a little bit more on like how much debt you have, and if you have undergrad debt or anything like that, that just adds on to it. Like you're just going to keep accumulating interest. And so I think it has the potential you have the potential to have a good work-life balance, but it does depend like financially, kind of like where you are. During COVID and like during the summertime, I was only working 3 days a week, and I was fine with it. I was still able to afford. I actually moved from New York to live with my parents right now, and I like it because I don't have to pay rent and I don't have to pay city rent, so I'm saving a lot of money. So things like that, you are gonna have to make some compromises. I mean, you shouldn't like look into buying a brand new car. Like, you really want to settle like all the financial things first. But obviously, like if you're married and you have a spouse and you have two incomes, for example, then you may not have to work so hard. So like it depends like on so much, but most people I know do work, 8 to 12 hours a day, like the days that they work, because dentistry is not a 9 to 5 job. It's really not. You start earlier and you end way later. So it's very relative. It's very dependent on your situation, I would say.
Thank you. Moving on to our next question. If like obviously like you mentioned opening a practice potentially in the future, but for somebody who does open a practice, how do you go about that, and how expensive could it potentially be, and what are some of the first steps you take when trying to open a practice in dentistry?
So it depends how you want to do it. Do you want to buy an existing practice from someone, or do you want to have a startup? If you have a startup where you start everything from scratch, you should probably have a consultant working with you to kind of go hand in hand and make sure that you're doing everything. Because I will be very honest with you, in dental school, you'll learn nothing about business. Like they will not teach you how to open up a practice. Like I have friends that have been to school all over and like nobody's been taught that. So you definitely want to invest initially in a consultant, and you'll have an accountant and an attorney, and you have to have this huge team to kind of guide you. If you buy your practice from someone, the most ideal thing is you work for an older dentist, maybe who's looking to retire in the next few years, and they'll kind of teach you, the ins and outs, and you'll also be used to everything. And then you'll learn, and then you'll be able to take over. Another thing that you may be able to do is maybe open up have a partnership where there may be someone maybe like 5 years out or 10 years out, and then you start as an associate for them, and then you end up being partners. That's also another model. It seems amazing. It is very hard to find these days. I'll be very honest with you, because you need to have a lot of money. And I would say bare minimum, you should probably be able to get a loan of $500,000 minimum. Like the bank should be able. You have to be able to qualify for that much of a loan. Starting out, everything is very expensive in dentistry, and people complain that dentistry is expensive, and it's like, yeah, well, if you see like how expensive it is to have your own practice, you'd understand why. But that's an average. If you have a smaller practice, it's obviously a little bit cheaper. But for my friends who have opened one, they've all had loans for about $500,000 to start out with. And if you do a startup and you have a consultant, they are not cheap either. I think they charge around 15 grand. And that's just to tell you what to do. Like they're not actually doing anything. So yeah, it's a commitment for sure.
Wow. Crazy. Thank you for that. Moving on to another question. This is from the YouTube channel. And they just ask, did you have any leadership or volunteering experiences that you think might have set you apart when applying to dental schools?
Let me think. I think I was. I was in grad school. I was president of this like minority pre-medical, like it was like a pre-med minority group. I was president of that. Med including like dental, medical, optometry, like all of the doctorate type of things. I don't know how much it set me apart though. Like no one really asked me about it. I feel like everyone has stuff like that on their resume. It's not like, oh my God, amazing. But maybe if you did mission trips and stuff, I feel like that's definitely something that stands out. I wish I did that, but I wasn't allowed to go anywhere. So, but yeah, I don't think that really, I did have something, but I don't think it helped me that much. I'll just be honest with you. It's very, if you don't have the numbers, it's very difficult to have like extracurriculars mask that, like, unless you do something like crazy, like, I don't know, like invent something. But you need to definitely focus on like that first. And then I think something that does probably help is having hand skills with other things. Like I love baking. I love cake decorating and things like that. That definitely helps with manual dexterity. Mm-hmm. So if you have like hobbies like that, I have a friend who makes like these small like charms like with her hands. I don't know how she does it. It's crazy. So I think stuff like that actually helps more, because it's like it's more like related to dentistry and all of that. But I had a position, but I don't think it helped me that much, to answer your question.
Okay, thank you. Okay, moving on to our next question. Somebody asked, does it matter to dental school what college you attend,
Um,
in your opinion?
I honestly, um, I don't think so. I mean, if you have a 4.0 from Harvard versus 4.0 from like a state school, yeah, like I guess Harvard looks better if you like think about it that way, but I think it's multifactorial again. Yeah. So I don't really know. I can't. It's a hard question to answer because I didn't go to like a top tier undergrad. I just went to like normal university, and even my grad school was a state school, and I still feel like I had decent amount of options, but I don't know.
Yeah.
I don't know. I think it matters, but I don't think it matters as much as you might think it matters. There we go. That's like a better answer.
Okay. Makes sense. Okay. Thank you. Okay. Moving on to our next question. For when writing your personal statement for dental school, how should one go about that? Or do you have personal tips, or maybe what was yours about, or something like that regarding personal statements?
Oh man. My personal statement. Tips. So one tip is definitely to pick like a general theme for your entire statement. Like just think in the back of your mind like what you want to talk about. Then try to tie in all of your personal experiences to kind of become like cohesive with that one theme. And I think that definitely helps. Everyone always has like that aha moment, and that's usually how people will start their personal statement with like, oh, like I was doing this, and this is when I decided that I wanted to pursue dentistry or whatever. But make it good, like make it kind of stand out. That's when you can really use the time to talk about your leadership and talk about your extracurriculars and kind of like how it's developed you into the person that you are today. And yeah, I go from there. I mean, I'm not the greatest writer, so I had to have my personal statement checked by like a million people. Even for residency, I had a personal statement, and I was like, oh god. So definitely like have someone to look it over. I'm willing to work with you. Like if you want to send it over and you want me to read it, I'm really not the best. I can give you recommendations, but I'll be honest, I'm not the best writer. But I think like creating a theme and making it very cohesive, you want it like short and to the point. Like don't write 3 paragraphs on how you want to help people, because like nobody, like we know you want to help people. You have to kind of make it like, you have to turn it into a story, but also relay like your points by staying within one theme, so it's like a smooth read.
Okay. Makes sense. Thank you. Moving on to our next question. So going with like obviously if you get an interview for dental school, what are some tips, or what was your personal experience for those interviews, and what kind of questions do they tend to ask?
So what I did is I basically had like a Word document. I looked up, is SDN like still a thing? Student Doctor Forum or something? No?
Maybe. I might just not know what that is.
There's like some forum that I use. I think it's called Student Doctor Forums, honestly. Okay. They literally used to like have like files of like most common questions asked on interviews. I am willing to, like, if anyone wants to mock interview, I'm good at interviewing. I'm a really good, like, I'm a good conversationalist. So better, like more than helping with a personal statement, I think I can definitely help with mock interviewing and stuff like that. So I was kind of actually like last year I actually had like mock interviewing workshops for pre-dental students, and they said that it helped them a lot. So that's something that you guys are interested in. Definitely shoot me an email and we can try to coordinate something for sure.
Thank you.
It's really not what you say, it's all about how you say it. So definitely keep that in mind.
Thank you so much for that. Yeah, for sure. The question. So with obviously one of the biggest factors to get into dental school is the DAT exam. For you, how is your approach when studying for it? And like in your perspective, what would be a very good competitive score to get into the dental school of your choice?
I did so. Oh my god, that seems like so long ago. I did the crack the crack the PAT. I think that's like a software for the perceptual ability thing. The perceptual ability. I used that. I used the DAT destroyer. That destroyed me. That's so freaking hard. And like honestly, if you can do that, you could probably like ace the DATs. I'll be very honest. What else did I do? Chad's videos for organic chemistry and general chemistry. I got C's in chemistry or general chemistry in undergrad, and that was my chemistry was my highest score on the DAT. So like he's freaking amazing. And bio, what did I use for that? I don't remember, sorry. I think I probably used like Chad's combined with the destroyer, like all of that stuff. Reading, you just wing it. I don't know. I was like never the person that like knew how to do reading comprehension. It was my lower score, and I was like, whatever. Competitive scores, I don't know. Again, I think like that SDN forums, or I think you can Google like average DAT score for each school. I think my science was like 21 and my overall was like 20. It wasn't anything great. My friends all had higher, like my friends that I met like later in life all had better scores than me. So yeah, but I think it was good. Like I got like 22s on chemistry and stuff like that. So it's definitely, it's fairly, I think my score was competitive for most dental schools. I did have like a handful of interviews, but I think like you really need to, try to master stuff. I think math and reading, I spent the less. That's the other thing. Prioritize. Like have your basics, like have your science score just be like really good. So even if it like kind of pushes your overall down a little bit, it's not the end of the world because they don't really care that much, I think, about math and reading. But definitely try to focus on the PAT thing because like there's been studies that have shown that your PAT score determines like how well your hand skills may be as a dentist. And it was one of my lower scores, but it wasn't terrible. But yeah, focus on that. So I'd say like, the sciences and the PAT should be your priority, and then use like math and reading like for the end.
Okay. Next question. This kind of just has to do with like your personal experience. Like obviously before going into like the dental school and like the dental world, like everyone has a certain perception of dental school and dentistry. So how would you say after experiencing everything, how did your perception change about dental school and the dental field in general? Yeah.
I think dental school is very rigorous. Think about like being a doctor and specializing in dentistry in like 4 years. Like it's really a lot, and you learn like how much you don't know even when you're towards the end of dental school. Dentistry is very humbling. Like you'll constantly learn from your mistakes. You'll constantly make mistakes, and like I think like building that confidence to like do things like I could do this in my sleep. still, like, I'm not that much more ahead of you guys. I'm at like 2.5 years. There's very few things that I can be like, I can do this in my sleep. Like, I can't. Like, when I'm like doing a procedure, I'm like always freaking out inside. That like anxiety and that like losing sleep and like freaking out to your friends all day, like that is just like, I literally have so many group chats with my friends, and all we do is like talk about what we messed up that day. Like, literally, like yesterday I tried to extract a wisdom tooth and I broke a root tip and I couldn't get it, and I was like, oh my god. And I literally, that's all I was thinking about the entire day, and I still think about that. Like, so that like anxiety, and I think some people don't have it. Me and my friends like all are pretty much on edge like 24/7. I think it's because we genuinely care and we want to be better and we want to do what's right for the patients. So that is definitely something. Like, it's very humbling, and you're, just because you're a dentist, like that's like just the beginning. Like, it's not even like when you graduate dental school, like you don't even know what's coming your way, kind of thing. So it's like one of those things where you have to be like very strong. You have to continuously want to make yourself better. You don't want to give up. You want to keep pushing through, because most people say that until you've been practicing for a solid 5 to 10 years, you really don't know what you're doing, which is kind of scary. But it's one of the realities. You know, you are doing a lot in a very short period of time, so it will take time before you feel comfortable with things. It's not like medical school where you're like medical school and then rotations and then residency for like up to 7 years, like, you know, all of that. Like, it's a little bit more structured for them, and you have to know like quite a bit. You know, it's not like you're just focusing on like the mouth, so it's like easier or anything like that. It is a lot. You are a doctor at the end of the day, so you need to know everything.
Absolutely. Okay, so I think this can be like our last question. But what is probably the most difficult thing about being a dentist in your day-to-day life, and then what's probably like the most rewarding or the easiest, or just something best overall? So like the best and the worst, maybe hardest or easiest.
About like pursuing dentistry?
Yeah, or just like being a dentist, like going into work. And,
oh my god, sorry.
Okay. Yeah.
Let it finish ringing. We get a lot of scam callers. I don't know why we don't just get rid of them.
Yeah.
All right, sorry, I just like picked up and hung up. But the best part is I love like who I work with. Like, I look forward to going to work. I love my staff. I love my assistants. I love my patients. Like, I love the whole interaction. You can tell the difference between like if I'm comfortable with doing a procedure, I'm like cracking jokes, I'm like laughing the entire time. And when it's like something that's like challenging, like I get really quiet and like everyone's just like tense and they're just like, and I'm just like, so I try to just make it like really fun. Exams are super fun because you just like come in, you like talk to them about like whatever, and like that whole interaction, like having patients come back to you, it is very rewarding. You know, like I'm like, I haven't even been in private practice for a year yet, and you know, there's patients that are like, I really like you, like I want you to be my dentist, I want to keep seeing you. It's a really good feeling, because they could go to anyone, and they could go to doctors who've been practicing for decades, you know, and they want to come to you. So that's really nice. I'd say like probably the cons, like it's you know, there's I would probably say like just like what I was saying with like the anxiety, like you wanting to do your best and you wanting to work fast. That's the other thing. Like, you don't have that speed when you're like new, and you don't want your patients to hate you if they're like in the chair for 2 hours, but you also want to do a really good job, and you're just like, oh my god, what do I do, you know, like that kind of thing. So personally for me, I think it does take a toll a little bit on your like your mental health. But I do a lot of yoga and like meditation and a lot of venting and all of that. So you know, you learn to overcome it. And I think just working like, I guess like 6 months now, I already feel a little bit more calm about things. But starting out, you'll be very, very much on edge. So I think that's like the one thing that like you want to stay calm, but you can't keep calm. That thing like that's probably like a disadvantage, just because you're inexperienced and you like, but I think the pros, definitely there's more of those than the cons for sure.
Awesome. Dr. Shah, thank you so much for everything, for your presentation and all the amazing responses to our questions. That's like all the time we have for today. And thank you for everyone that joined and is watching this video. And then just once again, thank you so much, Dr. Shah, like for all your responses. I really appreciate it.
Of course, anytime. You guys have my email and like my Instagram and stuff. If you guys ever want to like collectively do like any type of workshop or something like that, you guys could always, reach out. We can try to do it, or like even if it's one-on-one. I'm all about helping, and hopefully, this gave you guys more clarity on the whole dentistry life and process.
Thank you so much.
Mm-hmm.